With non-communicable diseases on the rise, AIA Vitality aims to raise awareness on the topic among workplaces in Malaysia. We speak to AIA Chief Marketing Officer Eric Chang and Vitality Group Chief Health Officer Derek Yach on how their latest survey could play a role in this. Thank you for joining us today, Derek, Eric. So, Malaysia Healthiest Workplace 2017, which is essentially a health check for companies and employees. And how healthy do you think Malaysian companies are doing? Where do we sit if you want to compare with countries like Japan, Singapore?
I think we definitely have a long way to go. I think there's a lot that we need to be doing here in Malaysia. Employees spend a significant proportion of their time at work. We know that Malaysians in general, our health prognosis is rather bleak today. So definitely there's a lot that needs to be done to improve the health of Malaysian employees.
What is your suggestion for better working places for Malaysian companies?
Well, I think there's a need for a holistic approach. First, recognizing that there are many factors that determine health in a society. The quality of health provided at the workplace is one, what the government provides is another, and what individuals and families are able to do and understand about the value of health is a third. And I think in all of those, there's always opportunity for improvement. I'm not so bleak and negative when I look at the long-term trends. And the long-term trends show there's been a slow, steady increase in life expectancy among Malaysians. And there's been a slow improvement in many of the major killers and causes of death and disease, from cardiovascular disease to cancers and so on. But that doesn't mean we couldn't be doing far more and far better here. And that's, I think, where this initiative is trying to raise the debate.
So what are the challenges would you see from this survey? Do you think companies will be open to talk about the conditions of their working places?
Well, I would certainly encourage companies to open up, because the whole idea is, about getting an understanding of your organization, what your employees think and how they feel, the state of their health. Because the very first step to making improvements is to be aware. And so as part of this survey, our goal is to provide that intelligence and that data to companies and report, so that really is the main thing we're trying to do here, so that they are aware of what they need to do and provide them with some practical tips and guidance on how they can further improve the health of their workplace.
So there are a few categories under this survey. How do you actually select the best, the healthiest employees, the healthiest employers? What are the requirements and criteria?
Sure. For the healthiest employer, we will look at the programs, a health and wellness program and the benefits that they currently offer to their employees. For the employees, we look at, the survey will help them to understand the difference between their own, their real age and the vitality age. The vitality age actually measures, their health conditions today, their state of being. And comparing the two, and the wider the gap, the less healthier they are. So through that, we compare against other companies and look at the ones that have the best results. So that's how we will measure it.
So Derek, just now you mentioned that a healthy company could actually save billions of dollars or billions of pounds for a company. How does a healthy company actually help with productivity?
First of all, when you look at the impact on healthcare costs as a start. The healthier the company and the more the focus on programs like Vitality, the more we see real declines in the healthcare costs. Secondly, the productivity of workers has been measured in many settings around the world. And the healthier workers are, the more the productive they are, both in terms of being more engaged when they're at work, as well as having less absenteeism, being less off work. But then there are a range of other factors that become important. A healthier workforce is also one where morale is stimulated and where the retention of the best workers is possible. And then finally, I'd say the real cherry on the top is when you can start doing what we're seeing in some markets, that the healthiest companies show the best return on stock performance over a decade or two. That attracts the attention of the investors, certainly the chief financial officer, and suddenly they realize that it's as important to be thinking about the health of the employees as they are about the plant and machinery that they devote a lot of time to, or many of the basic environmental factors at work.
So what actually sparked this partnership between AIA and Vitality?
AIA and Vitality have established a partnership across the region, to bring a program of health to our customers, to enable them to know their health, improve their health, and rewarding them for making healthy choices in their lives. This Healthiest Workplace Survey is really an extension of that, where we look at, we saw an opportunity to really just help Malaysian employees and employers to really know the health of their workplace.
So the survey has been open for registration since today and then until May. Are you working with any local organizations to promote the survey in Malaysia?
So we are working closely with our corporate partners, our partners on our Vitality program, as well as our corporate customers, to make sure that they take the opportunity to participate.
What has AIA done or is doing to actually promote healthy workplaces?
So AIA is a participant and one of the strong supporter, a partner together in Johnson & Johnson's smoke-free workplace initiative, where they work also with the Ministry of Health. So we are one of the key supporters of that. We also, as you know, we have the AIA Vitality program that I mentioned earlier. That really it's about bringing to life our promise of helping Malaysians lead longer, healthier, better lives.